Hydrostatic weighing. Hydrostatic weighing, which is also called underwater weighing, is considered the benchmark for measuring body composition. When compared with cadaver assessments, there is only a 1.5 to 2.0% margin of error. Most of the other methods of measuring body composition are based on formulas derived from underwater weighing research. The concept behind hydrostatic weighing is based on the Archimedes principle, which provides the following equation: density equals mass divided by volume. This technique originally measured the amount of water displaced when a person was completely submerged and exhaled all available air from the lungs, leaving only the residual volume, RV, and a small volume of air in the gastrointestinal tract. Fat tissue is less dense than lean tissue and displaces more water despite weighing less. The body is weighed on an underwater scale. As water buoyancy, i.e. the counterforce of water, reduces body weight significantly, and air and fat mass increase buoyancy, their respective contributions to underwater weight have to be determined. To minimize error with this protocol, the residual volume, or RV, should be measured in water. This volume can be 100 to 200 milliliters lower underwater due to the non-compressible nature of water that helps compact the lungs. Given the costs, equipment, and expertise needed to accurately measure RV, mathematical calculations are often used to estimate RV, which may introduce a margin of error of 300 to 400 milliliters. For every 100 milliliter error in estimation of residual volume, the percent body fat error changes by 0.7%. Hydrostatic weighing is not a practical approach for the standard fitness center. The apparatus is expensive and takes up a lot of room. Testing takes a considerable amount of time and expertise, and many people feel uncomfortable remaining submerged underwater after they have exhaled all available air from their lungs. This evaluation tool is often found in elite clinical settings and in many colleges and universities. Skinfold measurements. Subcutaneous body fat can be measured using a device called a skinfold caliper. In an average person, approximately 50% of body fat is distributed just below the skin. For this reason, body composition can be easily measured using the right tools and formulas. Skinfold formulas are derived from calculations based on extensive research derived from hydrostatic weighing. In general, the Skinfold caliper method produces a measurement that is plus or minus 2.0 to 3.5% of that obtained in hydrostatic weighing. Further measurement error can range as high as 6 to 8% if the trainer is inexperienced or uses poor technique. If the client is obese or extremely thin, or if the caliper is not properly calibrated. Before conducting skinfold measurements, the trainer must familiarize themselves with the exact site locations and proper grasping technique. Given the variability in fat distribution from site to site, it is recommended that multiple sites be analyzed. Most research supports using at least 3 sites when assessing body fat. The sites are also different between men and women. For men, the Jackson and Pollock 3-site skinfold locations are as follows. Chest, a diagonal skinfold taken midway between the anterior axillary line, crease of the underarm, and the nipple. Thigh, a vertical skinfold taken on the anterior midline of the thigh between the inguinal crease at the hip and the proximal border of the patella. Abdominal, a vertical skinfold taken 2 centimeters to the right of the umbilicus, about 1 centimeter to the right of the umbilicus, or about 1 inch. For women, the Jackson and Pollock 3-site skinfold locations are as follows. Triceps, a vertical fold on the posterior midline of the upper arm taken halfway between the acromion, shoulder, and the olecranon, elbow, process. Thigh, a vertical skin fold taken on the anterior midline of the thigh between the inguinal crease at the hip and the proximal border of the patella. Suprailium, a diagonal fold following the natural line of the iliac crest taken immediately superior to the crest of the ilium and in line with the anterior axillary line. Skinfold measurement protocol. Equipment: Skinfold caliper that is properly calibrated and a marking pencil, which is optional. Pre-test procedures. To ensure testing accuracy, the client should be optimally hydrated and always be measured prior to exercise. Since this particular test can feel intrusive to a first-time client, the trainer should make sure the client is familiar and comfortable with the protocol. If a marking pencil is to be used, it should be washable. An eyeliner pencil works well. Test protocol and administration. To ensure accuracy in assessing body composition using the Skinfold caliper method, it is important to measure each skinfold in the appropriate location and use standardized techniques. All measurements are taken on the right side of the body while the client is standing. Skinfold locations should be properly identified using anatomical landmarks and measurements. Use of a marking pencil will help ensure precise landmarks and consistency. Hold the calipers in the right hand, grasping the skinfold site with the left hand. Left-handed calipers are available, which reverses the hand position. The thumb and index finger of the left hand are opened to about 8 centimeters, approximately 3 inches, and positioned 1 centimeter, approximately half an inch, above the measurement site. Grasp or pinch the skinfold site, making a fold line that corresponds to the site instructions. To accurately assess subcutaneous fat, the skin and underlying fat are simultaneously pulled firmly away from the underlying muscle tissue. The pinch is maintained while the calipers are positioned perpendicular to the site and on the site location, 1 centimeter below the thumb and index finger, midway between the top and the base of the fold. Slowly release the caliper trigger, reading the dial to the nearest 0.5 millimeters, approximately 2 or 3 seconds after release. After taking the skinfold reading, gently squeeze the trigger to remove the caliper before releasing the skinfold pinch. Moving on to the next site, repeat the above steps. Each site should be measured a minimum of 2 times to ensure consistency between measurements. If subsequent readings produce a difference greater than 2 millimeters, a third measurement is necessary and the average of the 2 acceptable scores should be taken, i.e. within 2 millimeters of each other. It is recommended that the trainer wait 20 to 30 seconds between measurements to allow the skin and fat to redistribute. Record all measurements on a testing form. Body composition can be determined by adding the 3 skinfold measurements and plugging the values into the conversion tables. Tables 8-TAC3 and 8-TAC4, or by calculating body density, from which body composition can be computed. Personal trainers can also evaluate and classify the client's body composition using normative data. Page 203, which is the entire next page, is table 8-TAC3, percent body fat estimators for men. Page 204 is percent body fat estimations for women. This is based on the sum of the skin folds. And page 205 is the general body fat percent categories and standard values for body fat percentage. I'm going to read table 8-TAC5 and cover some of the information in the tables, and I highly recommend taking a look at it yourself because it's a lot of information regarding parameters to understand body fat for clients, and reading it out loud would not be helpful. Table 8-5, general body fat percentage categories. Women with 10 to 13% and men with 2 to 5% fat are classified as having essential fat. Women with 14 to 20% and men with 6 to 13% fat are classified as athletes. Women with 21 to 24% fat and men with 14 to 17% fat are classified as fitness. Women with 25 to 31%, men with 18 to 24% are classified as average. Women with 32% and higher and men with 25% and higher are classified as obese. Do the math. Marcy is a 35-year-old client who weighs 120 pounds. Using the Skinfold Measurements, calculate Marcy's body density. Her triceps is 24.5 millimeters, her suprailium is 12 millimeters, her thigh is 35 millimeters. The body density is the sum of the three skin folds and you subtract a crazy decimal number and then you add a crazy decimal number and multiply it by the sum of the three skin folds squared, and then you subtract that by a crazy decimal number multiplied by the age. It's best to just look at it. Alright, body density of fat tissue equals 0.9 grams divided by cc cubed, while the density of fat tissue is approximately 1.1 grams divided by cc cubed. So that's fat tissue versus fat-free tissue. Although these figures vary slightly by age, gender, and ethnicity, once body density is determined, it needs to be converted to body composition. Two of the most commonly used prediction equations to estimate percent body fat are Brozek et al. 1963, which is percent body fat equals 457 divided by body density minus 414, and Siri 1961, which is body fat percentage is equal to 495 divided by body density minus 450. These calculations provide generalized measurements of subcutaneous fat for an average person based on the populations that were used to establish these coefficients. Okay. Think it through. Newly certified personal trainers, or those new to taking Skinfold measurements, should turn more to experienced colleges for help with learning how to conduct this test properly. It takes a lot of practice to perfect the technique, so trainers should ask friends or trusted clients to allow them to practice taking the Skinfold measurements in an effort to become both accurate and consistent. Body composition evaluation. Table 8, TAC 5 presents body fat norms for both men and women. As previously mentioned, vanity is a common reason why many clients desire to lower their body fat levels. Personal trainers should also point out that personal health is negatively impacted when body fat scores are high. There is no established recommendation for reassessment of body fat composition. Since time and significant energy expenditure are necessary to reduce body fat, assessments should not be conducted too frequently. Quarterly assessments are appropriate. Programming considerations. Determination of body composition is essential for a personal trainer who is designing a personalized exercise program, especially if the primary goal is either weight loss or weight gain. Reducing excess adipose tissue is also important for any person trying to decrease his or her risk of major disease and dysfunction. To enhance the program's effectiveness, appropriate exercise should be used in conjunction with evidence-based dietary recommendations. Body composition values can also be used to determine a goal weight. This calculation is based on the assumption that throughout the fitness program, lean body weight or mass will not change. However, it should be noted that with any weight loss or gain, there is typically a change in the amount of both lean body mass and fat mass. Do the math. Consider a 47-year-old man who weighs 212 pounds and has an estimated body fat percentage of 21.3%. His goal is to reach a body fat percentage of 14 to 17%, which is the range for men desiring optimal fitness. To calculate this man's weight for the desired range, his lean mass must first be calculated. Since 21.3% of his body weight is fat mass, 78.7% of his weight is lean mass. 100 minus 21.3 equals 78.7. The decimal form of the percentage figures are used to derive a lean mass of 167 pounds. Step 1 is to take 100% minus the body fat percentage, and you'll get your lean mass percentage. Step 2 is to take the body weight, multiply it by the lean mass percentage. Your lean mass is 212 pounds. Oh, I know. Okay. That's for this specific client. Okay, step 3, after you have taken your body weight and you've multiplied it by your lean mass percent, to get your overall lean mass, you're going to take 100 and subtract the desired body fat percentage, and you'll get your desired lean mass percent. Step 4 would be taking the lean body mass that the client currently has, divide the desired lean body mass, divide that by the desired lean body mass percentage, and you would get your desired body weight. So in this particular client, a 47-year-old who weighs 212 pounds is 21.3% body fat, and his goal is to reach 14 to 17% body fat. The weight range corresponding to the desired body fat percentage of 14 to 17% is 94 to 201 pounds, or 88 to 91 kilograms. With regular aerobic activity, resistance training, and dietary management, this man would need to lose a minimum of 11 pounds of fat. Measurement of body size. Other anthropometric measurements. Though body composition analysis provides a more three-dimensional look at the makeup of the human body, peripheral measurements can also be used to determine health and fitness status. Anthropometry is the measurement of the size and proportions of the human body for the purposes of understanding human physical variation. The most frequently used anthropometric measures are height, weight, and circumference measures. For example, periodic height assessments are important, especially for women who may be at risk for osteoporosis. BMI is used extensively in healthcare settings to determine health risk and/or establish target weight values. Body mass index. BMI provides an objective ratio describing the relationship between body weight and height. It, however, cannot determine actual body composition, which means that BMI can unfairly categorize some individuals. For example, individuals who are extremely muscular or have large frames can score high on the BMI charts, resulting in a label of overweight or even obese, while older adults with decreased lean tissue and excess body fat may score normal. BMI calculations are presented on page 208 through table 8 tax 7 and can be used as a quick reference. As BMI increases, so do health risks. It is estimated that 65% of Americans are overweight and 35.7% are obese, with women aged 60 and older having the highest rates, 42.3%. Even more shocking is the fact that 18% of American children and teens are in the obese category. A BMI greater than 25 increases a person's risk for cardiovascular disease, metabolic syndrome, hypertension, and type 2 diabetes. Table 8-8 is a Bmi reference chart that can be used to discuss the health risks of being overweight or obese and to set long-term weight loss goals for clients. Calculating BMI is not only quick, but also inexpensive. BMI charts are used by many healthcare agencies to assess body mass and associated risks. If BMI charts are the only method of assessing body structure, The result could be misinterpreted and healthy individuals could be misclassified. A simple visual inspection should make the personal trainer question the label in these situations and proceed with a body composition assessment to gain a more accurate indicator of health risk. Online BMI calculators are available where an individual can simply key in his or her height and weight and be given the BMI, including one on ACE's website. The Center for Disease Control and Prevention website provides a BMI calculator specifically for children and teens. Think it through. An active, well-muscled client has recently participated in his employer's wellness fair. He reports to you that based on his height and weight measurements, he falls into the overweight category. However, according to the body composition assessment you have conducted with him, he is considered healthy and not in danger of being overweight. How would you explain this discrepancy to your client? Girth measurements. Girth measurements are not only good predictors of health problems, waist circumference as it correlates to heart disease, but an overall body assessment will provide motivation as clients see changes in their body dimensions. In the case of excess fat mass, clients will be inspired by a decline in girth measurements, while individuals who are interested in muscular hypertrophy will likely be motivated by increases in girth. When taking girth measurements, precision is necessary to validate the results. To ensure accuracy, the personal trainer must use exact anatomical landmarks for taking each measurement.